20% of my practice of reversals is redos from other failures. So it's kind of a, it's a cleanup practice. I like, can I get this done? Can I get one side done? Sometimes I put one side to the other.
Really?
Yeah. I'll flip a testicle upside down. They won't even know it.
Can you just cross the tubes? And then, does that make them a left-handed batter or something?
Yeah. You can't twist testicles this way. That hurts. But you can twist them this way.
All right.
And you can get 5 centimeters of tubing. So it's all about getting it done and not having the guy notice anything.
Welcome to another edition of Talk with Turek. It's a podcast about male fertility and sexual health. And sitting across from me this morning is my friend Paul Turek, MD, reproductive urologist and principal at the Turek Clinic in LA and San Francisco.
Guten Morgen.
Guten Morgen. We're going to be talking a little German today. My name is Rob Clyde. I'm a content producer and former patient of Dr. Turek. And it's appropriate today to say that because today on the show we're going to be talking about vasectomies.
And reversals. Yes.
And vasectomy reversals, which was a thing I didn't know was possible when I got my vasectomy.
These are two of my favorite things.
That's what you should say on your dating app.
Yeah, right.
I'm really into, my two favorite things are vasectomies and reversals.
Absolute favorites.
I'm sure they'd line up for you. I'm sure they'd line up for you. Well, good morning.
Good morning.
What'd you say? Guten Morgen?
Guten Morgen.
Oh, Morgen?
Yeah, Morgen.
Guten Morgen. So my grandfather was German, so I'm a quarter German. You're, how much German are you?
100%. Actually, I'm 100% Eastern European.
Okay.
So Slovakia, Czechoslovakia. I'm from Bohemia.
Really?
Yeah. So the eastern or western part of Czechoslovakia is Bohemia, and it's the original Bohemia.
Okay.
I don't know how it got the reputation it has in America,
Yeah.
but I took my girls there this summer to see the homeland of 800 years.
That's cool.
And it's beautiful, and it's raw, and the Tatra Mountains, and it's Bohemia.
Well, we were talking German because I told Paul when he showed up, I was like, I might have had a little something to drink last night. And it was because a friend of mine had a Oktoberfest at his house. We had legit Hofbrau from Munich, pretzels and mustard and sauerkraut and sausages, lots of good food.
Needs something to be desired.
That's
currywurst. Right?
Yeah,
they have that.
that's
That's
right.
like the big innovation in German food.
Yeah.
In 20 years is currywurst.
I love a good schnitzel, though.
Yeah, they are good. So funny, when you go to Germany and Eastern Europe, the beers are 600, 700, 800 years old. They're very finished. The lagers are very finished. The pilsners and lagers are high art. I mean, it's like French champagne. It's not the same, but it's very beautiful stuff.
Have you ever been to like an Oktoberfest?
Oh, yeah.
Oh, you have?
Yeah. I
See,
mean, I
I
grew
need to
up
go.
with those back east, and
Yeah.
I haven't been to many in Germany.
Do you have lederhosen? Do you have yeah?
green suede lederhosen? Yeah.
You do?
Yeah.
See, that's why I felt a little out of place yesterday because a lot of the guys had lederhosen, and I
don't think I've worn it in years.
my gag was I showed up and I was wearing this hat, right? So I was wearing my Dodgers hat, and they were like, "Oh, where's your lederhosen?" I was like, "You said it was Oktoberfest. It's like the Dodgers in the playoffs. Like, and we're celebrating October because the Dodgers are in the playoffs again. That's my Oktoberfest. I'm wearing my uniform." So, all right. So today we're talking about vasectomies, right? And I have a bunch of questions that I've lined up so that we can just educate the guys and girls out there that are listening to us today. And this is what you do for a living.
Yeah, I mean, I like vasectomies. They're done in the office between patients and in the office, and there's a story there. I mean, male contraception had most of the innovation until recently. It was in male contraception. So it began 3,000 years ago in Egypt. They use pig intestine for condoms. There's evidence of that.
That's the initial contraception.
First contraceptive report.
Okay.
Then you go, say, 200 years ago, vasectomy was developed in London.
Okay.
And then 150 years ago, the rubber condom was invented by guess whom?
I have no idea.
Goodyear tires.
Get out.
Before the tire.
Before
condom
the
came
tire.
before the tire.
I love that.
Yeah. And then after that, it's sort of been the same. And then female contraception took over. But nothing beats a vasectomy for contraception.
Okay, why?
The secret to contraception for us and the way why they fail is called compliance. So if you have to do something at the time or in preparation, it fails. We just aren't very good at repeating things. So birth control pills are missed. Condoms have a hole in them. you put them on, there's an error, falls off. So vasectomy and IUDs for women and uterine devices are the best because you don't have to think about it at the time or prepare or do anything. And that's why they're so effective.
It's a decision to make, and we'll talk about that in a lot of the questions. And what you're telling me and our audience is it's not a permanent decision, vasectomy.
I didn't say that yet because I have to say it's permanent, and mine are permanent unless I want to reverse it.
Okay, so say it correctly, Rob, is to say they are permanent.
These are permanent.
That's the point.
But I reverse them for a living.
Okay, right. There you go. Didn't know you could do that. When I was thinking doing a vasectomy, I thought this is it.
I've even had men who, I have a brosectomy, which you know about.
I do know about. So tell them what the brosectomy is.
So I developed this thing called the brosectomy and trademarked it. And it's where men come in together and they do a vasectomy, not together, but in the same.
They're not holding hands.
Right, in the same moment, like, sequentially, but then we hang out and we give them massages and feed them food and they can have. It
was a great
alcohol.
Experience. I did this.
You were a brosectomist.
I was a brosectomist.
And now you're in a club, and every time we do them, you're invited to join us afterwards for the celebration.
Yeah,
there's alums. There's
alums. Okay. Why do you do brosectomies? It's just because of.
So I have a feeling that men do better in groups. The buddy system really works. When I go surfing and stuff, I like to go out with somebody because it's more comfortable. Someone's got your back. Mm-hmm. I had a psychologist come on and talk about the buddy system, and the military relies on it. That men support each other in times of need. And so there is a real psychology there and I've just found that men did better because I tracked them carefully and how many pain pills they use. And the men who were with buddies, they would stay together for a couple days. Are you hurting? Yeah. Is that hurting? I guess that's normal, and they would tell me, but they did really well, like much better than a guy alone.
Or with his wife. So I did the brosectomy with my friend Marcos. Just saw him this week, by the way. Had lunch with him. That was great. There's definitely an awkwardness. I'll tell you, like when I was doing IVF and we went to the clinic and I had to
make love to a cup,
and your wife's in the lobby, and I'm not embarrassed by it, but it's like, hey, I'm going to go do this now and see you in a little bit. I'll come back. And when you come back, you're flushed and you're embarrassed. In the same vein, the brosectomy was nice to have just a buddy. We're not going to get too deep and emotional through it.
Right.
It was more just like let's lift each other up, let's support each other, and this is a big decision we're making together. Right? Men
don't know how to heal after this. They have no idea. Like they go to a dentist appointment, they know a little bit about, but it happens once. It's never happened in their life. They've never had something happen down there. It's an unusual place. So having someone go through the same thing and said, yeah, I'm feeling that too, and feeling this, and maybe, it's great.
It is great.
There's a biology behind it.
There is.
And so I defend it. I think it's great.
We'll keep defending it. I do too, and I'm promoting it. Let's talk about the decision. So you probably consult with guys before they come in, right? So I've come in. I'm in my 40s, and I'm pretty sure I'm done having kids. I've got 3. I'm hypothetical. I've got 3 kids. I'm done. I want to have a vasectomy. Don't have to worry about no condom, no preparation in the moment. And so it was a surgery of ease to give myself a break and not have to worry about contraception. Like
it's liberating is the word.
Yeah.
From a lot of things that you've been thinking about forever. And condoms are so high school.
They are, right? They are.
It's just not. You have a couple choices. You can stop having sex. You can pull out,
which isn't 100%.
Right, but it's not bad. There's some data that it's not. It's about the same as a condom, but you got to know what you're doing, and no one can teach you, right?
Yeah.
And you can be abstinent, or you can get a vasectomy.
So I come in, I say I'm ready for a vasectomy. So what do you do?
So we have a consultation, and I go over, what the procedure is. So I'll start with a little bit. I mean,
you brought
this is
props
the anatomy.
Yeah.
So the male testicle is down here in the scrotum, and then it comes out through the ejaculate, which is here, and it has to go through some pipes.
Yes.
So this is the pipe. There's one pipe in there.
That's what we've been calling a tube.
Yes, that's the vas deferens. It's a pipe, and that's the sperm travel up that pipe during sex.
Okay.
So they actually start from behind the scrotum, and during the process of ejaculation, they get pumped out.
Okay.
So it comes a long way.
Yep.
And there's one pipe on each side, and that's what's interrupted. So nothing happens to the testicle. One man had a vasectomy in my practice, and He was an opera singer, and he walked by me as I was doing my note. When he was done, he goes, "Thanks, good job, Doc. Boy, that was really slick and really." And he had this perfect falsetto, and I looked back at him like, "What is that?"
What I do?
Yeah, and it's like, and he said, so the whole concept was culturally he was neutered.
Yeah.
And he was like, he was
Lost his voice.
Yeah,
because
his
of it
voice
and
would
everything.
have falsetto, but he did a perfect falsetto, and it alarmed me. But it doesn't do that, right? So vasectomies don't interrupt any testicular function. It's just
Okay.
the outflow of sperm.
Okay, so I want to be clear too. Outflow of sperm, not ejaculate. So sperm is coming
point.
from the testy up the tube, not.
So the tube is blocked, and that's it. Say where that circle is,
Yep.
and then the ejaculate, the volume of the semen, isn't really driven by that. It's driven by the seminal vesicle here and the prostate. So you won't notice a change.
Got it. So that's a big question for a lot of
Yeah,
guys. So I'm going to get a vasectomy means I'm going to have less semen when I ejaculate. Will you or will you not?
5%.
Okay, so you won't notice it.
99% of men won't notice it. And the erections aren't altered, and sex drive isn't altered, because
Okay.
everyone thinks your sex drive's going down because your testicles are... No, that's the testosterone issue. It's
Okay.
not affected. So it's really good.
Yeah. So the sperm itself comes through the testy, goes up the pipe around, picks up the ejaculate or the semen at that point.
So that's called emission. Emission is when the sperm gets pumped into this chamber,
Yeah.
and then ejaculation as you know it occurs when everything starts happening in the pelvic thrust, and then it gets pumped out.
So that's the anatomy. So what are you doing during the vasectomy is you're just...
So the consultation starts with all that.
Okay.
Goes through the anatomy. Some men faint. I'll stop if I see them lilting.
Just in the consultation?
You want no photographs. It's always pictures and
Yeah.
stuff like that. And if I see them kind of, I'll stop and, it's like a blood draw or something.
Yeah.
They
Sure.
have reactions to it.
Yeah.
Then I go through the risks and complications, and they're very low. And then I go through the history of it too. I mean, vasectomies are 200 years old, but they were done with incisions for years. After World War II became popular in America, and we did incisions on each side of the scrotum to access the tube. And then the Chinese developed the one-child law in the 70s, which meant after one male child, mandatory contraception.
Right.
Wild.
Yeah.
Wild.
Yeah.
And they were doing a Tenement Square at 10,000 a day with incisions, and they were having infections and all this stuff. And so they developed this thing called the no-scalpel method, which was a way to do it with a puncture. So that's what we do in America. That came to America in 92. I was in my fellowship. I was in my residency in Philadelphia, came to New York. I saw it within 6 months of arrival, and I said, this is the bomb. So I'm probably one of the first 10 practitioners in America to do the no-scalpel method. Now, 30 years in, 3,000 cases, really good.
Or are you still doing scalpels in America?
It's probably maybe half, but the nice thing is you just puncture the middle of the scrotum and you work through the tubes through that, because you can hold the tube with your fingers a certain way. So it's just a little technical issue, and it's just great. I mean, it is the biggest innovation in the last 30 years.
So what actually happens in there?
So the tube comes through the skin,
Okay.
and it's through the puncture, and then you can do whatever you want to it. And so there's about 30 things you can do at that point to occlude it or stop the flow. So what I typically do is I'll cut it, and I'll cauterize it with a little device so it scars the inside, and then I put a clip of titanium. They're little titanium clips. They don't rust, and they don't go off in airport terminals or scanners. So
Okay.
I describe the technique to them, and then I put a stitch in it when I'm done. So the complications that we talk about are pain and infection, bleeding, all that stuff. I have a pretty good series. I don't really have any of that stuff. But there's big talk about chronic pain and things like that, and we can spend an hour on things like heart disease, prostate cancer, dementia as long-term effects of blocking the tube. And these are active on social media right now. But I'll just say simply that there have been hundreds of studies in a lot of these areas, at least 30 on prostate cancer. And it's a lot of epidemiology, which is science that draws associations but not causality. So you don't have animal models saying, oh, you do a vasectomy, this rabbit develops this. So causation is a lot of statistics, and they go back and forth. But I would say our national organization has guidelines, and they've looked at all this stuff, and they don't think there's any real association. Some of them are clearly disproven, like heart disease, and some of them are, the weight of evidence does not favor prostate cancer development or dementia, progressive aphasia, things like that. But I watch it all the time, and the best studies come from countries like Canada and Sweden where they have single payer systems where everyone can be studied and there's no bias in the selection of patients, because that's what the American studies have, bias. So one study said prostate cancer rates are 20% higher after vasectomy over time. The guys who got the vasectomies were healthcare workers. The guys who didn't were farmers. Okay, this was an Italian study, actually. So that's a bias, because farmers may not go to the doctor as much as healthcare workers, and they're not going to see the prostate cancer screening going on in the hospital, right? So you can't control for that.
Yeah.
And it's a 5% difference. You could do that. These studies don't control for genetics.
Yeah.
Ever, right? So
Right.
Those are 5%ers, bang, 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 on top of each other, which will destroy any significant findings. So it's very nuanced, but so it's very safe. It's very safe. One of the things that upsets me on social is when people say that, well, of course he's going to say that because that's how he makes his living. But that's total misinformation, Hippocratic. I mean, as doctors,
Yeah.
we think about that stuff. Of course we think about that
course.
stuff. We don't ignore it because it's making us, I mean, I'm stunned at what the public feels real medicine is all about. I'm stunned about what's happening.
I am too. I mean,
So that's why we're here.
That's why we're
telling
here.
the truth. We're being authentic.
okay, so now we've done our consultation.
So the consultation goes through all of that.
Yep. And now I'm just going to schedule a vasectomy. I'm coming in next Tuesday. What do I have to do?
Nothing. Just come in.
Just
make
come
sure
in
you
next
get a ride
Tuesday.
home.
Yeah, take a shower.
So I tell you, I'll give you some Tylenol, and then you can have a choice. You can have nothing, laughing gas, or Valium. So men like to be sedated, some men. And I say, you don't have to decide until you come in, because maybe you're fine. But the laughing gas is great.
I've never done laughing gas.
Gas and jazz is great.
So your thing is jazz. You like to play
Gas
jazz,
and jazz.
in
And
gas and
nitrous
jazz
oxide.
in the operating room.
Absolutely. So the laughing gas is good because, first of all, it's a sedative, like Valium. Then
Yep.
it's an amnestic, so you reduce sense of time. So lots of men will come in and they'll be on their backs, right? We're starting, and they'll say, "Did you guys start yet?" Like, because it's been a couple minutes or something. They said, "Yeah, we just finished."
We're just finished.
Because they just lose sense of time. And then the third is that it's an analgesic, so it helps with pain. And there isn't much because I use a cream on the scrotal skin. I
Yep.
have several layers to it.
Yep.
What I don't like that much is the no needle, no scalpel. So that's another innovation, sort of.
Really?
The no needle, I don't have it's a gun.
Okay.
It's called a Metajet gun, and it shoots. It was used for vaccines in the 50s, where you
Okay.
get that
Yeah,
patch.
yeah.
You see people with that mark on their
I
skin.
do, yeah.
That's a scar from the jet throwing high pressure air into you, right?
Okay.
So it's a high pressure injection, and you throw it on the skin, and you don't need a needle. But the needle's quiet and fast, and the jet is six punches, so pow 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 per
Okay.
side, and I just see guys going because they're not watching it, and they hear a gun go off,
Yeah.
and it makes them all jumpy.
Sure.
And it's like, that's not cool.
So what do you do?
I numb up the skin with the
Uh-huh.
cream we use for babies'
cream.
IVs,
Yeah.
and then I'll put a little needle in, and they hardly ever feel it.
All right. Well, that's the right decision. Do they get a scar on their
No, not really.
scrotum? Like
No, I do it in the middle
people
where
do
the
it.
dark
No,
line
but
is.
I get with yours
Yeah.
they don't. But when they use the gun, do they get the same kind of scar that my grandma has on
No,
her
because the
shoulder?
skin is folded more. But it does take, and it's not that reliable. So then you do it, and then men are usually comfortable for most of the day. I'll tell them to take a day off, and then most of them are doing full activity in 4 or 5 days. Sex 5 to 7. The only worry really is when you're having sex, you're very fertile.
All right, let's slow down for a second. So anybody that feels like they need to have sex 5 days after vasectomy, I think they need to chill. Right? I don't understand. So that goes to one question. How long till you know you're sterile?
So the biggest issue is you put a block in this tube,
Yeah.
but there's a billion sperm that still need to get out.
Got it.
So ejaculation is inefficient. So a lot of it doesn't come out each time. So it takes about 35 ejaculates or 3 months to clear the pipes. And before that, you're going to be fertile.
Really?
So one guy comes in and he says, I'd like a vasectomy reversal. And I said, oh, okay, I like those. I said, when was your vasectomy? And he looks up and he goes, last Wednesday.
Are you serious?
He said, I regret it. And I said, well, why don't you just freeze some sperm? So he spent the next month freezing almost normal amounts of sperm.
Really?
He never had the reversal.
Okay, so but a person that's trying to have sex 5 days after, that means they're jerking off 7 times a day for 5 days to clear the pipes so that they can.
I mean, they don't want to be cleared 5 days after. They can have sex, they can start ejaculating whenever they're comfortable.
Yeah, but if they just had a vasectomy, they could possibly still have, like you said, they have sperm still in there. They could still get somebody
absolutely.
pregnant, right? So I'm saying,
And even at 35, you need to be tested.
right. And I remember I was. So after a while, like a month later or so, I came in and I was tested and I was.
Yeah. So I make the testing easy. I do at-home collections. I pay for the sample. Okay. So it's really going well. And hard to refuse. You don't have to go somewhere uncomfortable.
Yeah.
But to your point of like, why would you want to ejaculate that soon? There's a race in my practice. Like, so who can be cleared the fastest?
Okay.
And it was in the 30-day range, went to 24, and there's 2 people holding at 17, which means a week off and 3 times a day for 10 days. And if you want to do this, it's very technical. You have to, have the date of the procedure, and the answer is the date of the semen analysis. So you have to get that thing ordered quickly, because if it comes late, you're gonna.
That's hilarious.
So yeah.
How big is this tube? Like if you pulled it out, is it like this?
No, I think of it as like a pencil lead, a little more than a pencil lead.
Okay. All right.
So 3 millimeters.
3 millimeters comes out. Done.
Yeah, a little knuckle that comes out.
Yeah. Done. Cut it.
Drop it back in.
Solder it. Drop it back in. That's it.
Yeah.
Okay. So does it hurt? No, I would say it didn't hurt. Yeah, it doesn't hurt you. I would say it didn't hurt. I mean, it's just like anything. You're going to feel a prick here. Okay, I felt that. That was it.
Yeah, half the men feel the prick, or the other half are laughing.
There you go. So great. And recovery for me was a piece of cake. I'm telling you that, number one, I was a brosectomy guy. So that you just said the psychology and the biology of that do better faster. It is one of the only times in my 30 years of marriage where I get to sit on the couch and somebody bring me a Diet Coke? Can somebody bring me something? Like, you get pampered. It's kind of nice for
March Madness.
Yeah, March Madness. Is that why the vasectomies are?
Yeah.
Because that was a question here on my list. Why are so many vasectomies?
It's called Vas Madness. It was started in Oregon by a urology group who sort of said, "Hey, it's that time."
So yes, the recovery is pretty easy. I don't know. I didn't feel like I couldn't walk around. There wasn't pain. I had to take it easy for a couple of days, and that was it. So
the big concern with pain is it's called post-vasectomy pain syndrome, PVPS. And I have studied this for years, and I have broken the pain down into 4 types. There's surgical pain, which is the initial procedure. My man average 2 pain pills, one that evening, one the next morning.
Okay.
Then there's another pain that's a blip like that, which is I call inflammatory, which is granuloma. So if you spill sperm outside of the tubes, you react to it.
Okay.
And that causes inflammation, but not infection.
Okay.
So that pain is temporary, gets better with non-steroidal anti-inflammatories and time. And then there's 2 types of pain that are considered chronic, in my view. One is you block the system. Behind it is the testicle, so you block it here, and you're still making sperm.
Right.
Normally. And it has to go somewhere. So it tends to fill up the system. The epididymis is an organ of maturation. And so usually mature sperm makes a motile, but if it's blocked, it'll start consuming them like a graveyard and start eating them up and dissolving them. That's where they go.
Okay.
And sometimes if you put a block here, it's too much pressure and men feel uncomfortable. It feels like pressure, too cakey, congested, blue balls.
Yeah.
So you can have that sense. And so you reverse the vasectomy for that pain, it gets better because you've decompressed the system. So what I decided about 15 years ago is I was doing these reversals, and the vasectomies were really low. And I said, maybe you should give it more tubing. So now I puncture here and go way up here, and you have a lot more capacitance, right, in the system to absorb back pressure. So I actually haven't seen congestion in about a dozen years.
Huh.
But that's about a 1%er. And I see them a lot and reverse them. And I had one patient come in, he had a vasectomy, he wanted a reversal, and so he went 4 kids, he wanted more. And I talked to him, and he was having post-vasectomy pain, and it was congestion. And so I said, well, we should help that too. And sure enough, we did it. He had a kid, he felt no more congestion.
Okay.
Then he had 2 kids more, and he came back and he said, I want another vasectomy. And I said, well, after your vasectomy, you had pain. So do you sure you want it again? But his vasectomy was here, and now it's open. So I said, I got an idea. Let's just do it really high.
Yeah.
So he never had pain after the second one. So that's one pain. And the fourth pain is post-vasectomy pain syndrome, I think, which is non-anatomical pain. So it's nothing to do with any of those things. And I've spent a lot of time talking to these men, and I think it's a man who had a bad experience and got no care, and they spin out of control. You could say it's in your head, but it really is real. Mm-hmm. I don't treat these men surgically. I don't put blocks in them. It's not anatomical pain. I stay away. I don't touch them. Give them pain therapy, neuromodulators, anti-inflammatories, and tell them they're going to be fine. If you cross the line with men during the procedure and there's a problem or it doesn't go well, they're not the same. So I promise them this will go well, or we're not going to do it. And I'll just stop in the middle and say, you're a little too nervous, panic attacks, something like that happens. That's it. We'll do it under sedation in the operating room. We're not going to even and say, no, I'm fine. It's like, nope. Because if you cross the line, getting them back is not easy.
This is really interesting to hear, and I want the audience to make sure they're getting that. There is probably a psychological experience that they're happening during the procedure at any point that you say, whoa, if this is not going to go perfect, essentially, then we're not going to do it.
Remember A Few Good Men?
Yeah.
Jack Nicholson on the stand. There's a general. Tom Cruise comes up to him, and the other lawyers in the Navy are telling him, if you can't take him down, don't go there.
Right.
Don't go there. I will literally stop before I start and say, this isn't going to happen today.
Brilliant.
Now I do it ahead of time.
Yeah.
So that pain, that PVPS syndrome, it's a syndrome, is a post-traumatic stress disorder. These men had an event happen to them that they didn't know could happen to them. And it's real.
And
you
it's
have to admit it.
manifesting as pain in some level.
Yeah, but they're anatomically fine.
Yeah.
So you just have to take care of them.
So now we want to talk about reversals. Tell me about reversing vasectomies.
Yeah, my favorite, the new ones are young men coming in single, wanting to control their fertility and freeze sperm and then have a vasectomy, never having kids. And now they, of course, within a year typically of getting their vasectomy, they'll find somebody. It's so interesting.
Yeah, I bet.
And they do want it, and they do know that they're counting on the reversibility of it. So it can be new relationships, it can be the same relationship, and it can be first-time children. That's usually
so. I think what's in my head right now, and probably be in more conservative people's heads that don't know how this doctoring works, but is it okay to be getting vasectomies and reversals and then another vasectomy and reversals? Is there a limit to how often you can do this? Is it a procedure that is now so elementary to somebody that you said you've got reversals, like you got that down, that's your favorite thing to do? So would you say to somebody, get a vasectomy, you can always get a reversal?
I did publish a paper 15 years ago, and the press release came out is vasectomy the new condom?
Okay.
And the Huffington Post yelled at me and got angry with me because it doesn't prevent against STDs. But the point was, I think it was on NPR, had a man come in, I had a couple come in as an example of this from Alaska, rural Alaska, very organic people, do not do pharmacies, way out in the woods. Mm-hmm. And they had a vasectomy, had kids, one kid, vasectomy, a reversal, a kid, vasectomy, and then he calls me. He wants another kid. And that's their contraception, vasectomy. So I was his fifth procedure, second reversal. It went well.
It did. So they do it in a different place each time.
Yeah,
right.
It's not. I think I only got one side done because there's tubings missing and all that stuff. But that to me is the Olympic sport of it. Is like I'm good at the early stuff, but these are the real challenges. And as a master surgeon, these are the kinds of things I like.
So some people in this country would say that is a little bit unusual to use major surgery to be your condom.
This is perfect for them. They would have done it all day.
Okay.
And I was impressed. I mean, I don't. So I've done about 3 or 4 fifth procedures. I have a one and done account, like the vasectomy account, which is you had your vasectomy, I'll reverse it, and I'll do your next vasectomy. Because a lot of guys, like you said, don't realize that.
Like a package deal, you mean? Like
yeah. So now it's a 2 and through. So it's what used to be 1 and done. Now it's 2 and through. So they'll come in and they'll pay for the reversal and the next vasectomy, and whenever they want. And maybe I'll open it up, but it's pretty cute because they don't know that. They don't know you can actually have it again. They like their vasectomies.
Sure.
They're so convenient, and So it's, but you know, not every surgeon can do that. 20% of my practice of reversals is redos from other failures. So it's kind of a, you know, it's a cleanup practice.
It's almost like a plumbing job or
Sure.
or a contractor gets in there, is like he has to first deal with the mess that the last guy left him and how he did it, and now I have to
It's the
do
same
what
thing.
I do.
That's what I like. I like, can I get this done? Can I get one side done? Sometimes I'll put one side to the other. You can
Really?
yeah. I'll flip a testicle upside down. They won't even know it.
Can you switch? Can you just cross the tubes? And then, like, does that make him a left-handed batter or something? Yeah. I wonder if it changes there.
So you can't twist testicles this way. That hurts. But you can twist them this way.
All right.
And you can get 5 centimeters of tubing. So it's all about getting it done and not having the guy notice anything.
What happens if a reversal fails?
You're back to your vasectomy usually.
Okay. That's it.
So it can fail for 2 reasons. And one reason it fails is you're not making sperm. Mm-hmm. So I had a heart surgeon come in at age 70, had a vasectomy, wanted it reversed in another relationship, and at 70 he had a reversal done. It went well, and he had a sperm count, and then he tried to conceive at 72, and his sperm count went away. He had no sperm, and so it could either be that it closed down or something else. And since the rate of closing down in the practice is 2%, and he's in his 8th decade, we checked some hormones, and he wasn't making it anymore. So he actually stopped making it.
Done. But he was 72. Okay, let's do some rapid fire here.
Yeah,
Just
sure.
answer some questions for me because people want to know. How do you know the vasectomy worked?
You have to check it after 35 ejaculates or 3 months. You have to check the semen.
And just see if there's
90% of men will be cleared at 3 months. As long as you have sperm there, you're fertile. The chance that you'll have sperm at 3 months in my practice is around 10%, and then you need another one at 4 months. The chance that you're going to fail the procedure, and a failure for me is very strictly defined as an unwanted pregnancy or an unwanted sperm count, is about 1 in 3,000.
Okay.
A persistent sperm count to me is just as much trouble because, like, doc, what do I do?
So, yeah, at that point, I will say to every guy out there, too, the first time you're having sex post-vasectomy, I looked at my wife and she looked at me like, this Paul guy better be good at what he did because this is it, man. We can't afford to have another kid. Like, that's what, you know, and I don't mean financially, but we were done. We can't have another kid. And we're just looking at each other like, I guess you don't have any sperm in there. And it, so I'm 0 for since then.
Oh,
so
that's the other
good.
question is, can you fail it later?
Can you?
Well, I haven't seen it in 30 years. But there are reports of men who get checked, their sperm counts get checked 10 years after vasectomy at reversal to see if what's there. And you do see 9% of men have occasional dead sperm there.
Okay.
So that's the data. But I've never seen a late failure.
Does vasectomy affect my testosterone, my erections, or my orgasms?
No, no, and no.
Okay.
But give yourself a week or 2 to readjust to things because you could be very tentative early on.
It's not going to change my sex drive.
No, because that's driven by testosterone in your life and stress. So I find men are much more liberated afterwards, and because they don't have to think about it. And I find that the sex is more enjoyable.
Okay.
Now, remember, it doesn't prevent STDs and stuff. So you're still going to get the gonorrhea and syphilis and chlamydia.
If you're not using
right.
a condom. Can you feel if someone has had a vasectomy?
If you're highly professional and you're good at your exam, you might be able to, right? Because there's a tiny little knob there, a little bit of a blip in the tube if you examine someone carefully. But other than that, no.
But the partner cannot tell.
The average non-doctor provider partner who doesn't examine someone thoroughly, yes, you wouldn't know.
It doesn't change the way that their sex is my point.
I sometimes get these young men in, well-hung young men in the entertainment industry coming in.
All right.
And they'll sit there like from Boogie Nights, Dirk
Diggler.
They'll sit there like Dirk Diggler. And so I need a vasectomy, and it's like, oh, okay. And you examine them, and then I examine them, and they're a good candidate and all that. And then we'll sit down and talk about it. And their questions are entirely about what's it going to look like? How's it going to hang? How's my jacket going to change? And I say, you're in porn, aren't you? Because like after about 10 minutes, like you're in porn. So I'm proud of this. I have a dozen porn
Porn
stars
stars.
who didn't notice anything, and just things are just, and there, I said, I make my living this way. Nothing can be different.
Yeah,
It's pretty
right?
cool. So I would call that the highest measure.
How often would you say that men regret their vasectomy?
5%.
Okay.
Not because of a complication, but because they want kids again.
Yeah, they have a new partner that wants
Right.
kids, and
Interestingly, we do talk about banking sperm. So there's 3 ways to preserve your fertility. You can reverse it, you can do sperm retrieval, and you can do banking sperm ahead of time. Banking sperm ahead of time is, it's a commitment. You got to do it before the vasectomy. You have to pay for an account to open. It's
Yep.
probably $500 to $1,000 a year. You have to keep the account open. You have to get blood tests that the FDA requires to keep the sperm to use it. And so, it's a little bit of work. You can do it online. You can do it in brick and mortar places now. So it's a little bit easier. But when men come in to the practice routinely with a vasectomy, with a new partner, with bank sperm, they'll say, we'd like to talk about reversal. And I'll say, you have bank sperm. Why don't you just use your bank sperm? And inevitably, the partner will say, I'm not doing that. I'm not going to go to IVF or do my first baby. I'm not, no, sorry. And the guy's like,
a couple last questions here, and then we're going to wrap it up. Does reversal change your sex life for your hormones or your testosterone, anything?
no,
like
similar to a vasectomy, it's restorative.
that? Okay.
So I don't have anyone with any issues like that. And I don't have anyone with chronic pain after reversal, even though I do lots of machinations and stuff. I don't have anyone with pain afterwards because you're dealing with limited resources, right? So the tubing and stuff like that.
So you mentioned the guy that wasn't making sperm anymore. Is there any quality differences in sperm post vasectomy and after? In other words,
Great question. Does the blockage cause a problem? And I actually studied that and published it 10 years ago because we were worried about, does the fact that it's blocked for 10 years cause a problem in the machinery in the factory?
Yeah.
So we did a study of men, fertile young men, chromosome content in sperm.
Okay.
And then we did men with a 10-year-old vasectomy and took their post-reversal samples and look at the chromosomal content of their sperm to see if there were differences in chromosomes, which is kind of a gross measure of production efficiency and
Okay.
quality control. And there's no difference.
Oh, well, that's good to know.
And we see that with the fertility too. And the other question is, does it change your fertility? And that's a big one. Am I less fertile after the vasectomy reversal than I was before the vasectomy? The answer is maybe for a while because you make sperm antibodies. So think of a vasectomy as a vaccination, and then you develop, you react to it, and then it goes away because you're sort of not exposed anymore. And then you do a reversal, you reactivate the system. So you make antibodies again to the sperm, and those can stick to the sperm and have the trouble getting through the female reproductive tract because the female sees the sperm as something with an antibody on it, probably a bacteria, and kills it. So the cervix is a very good filter, and it'll stop it in its tracks. So you can be infertile for a while. And then once that settles down again, the immune system, then you're fertile again. So I would say the long run should be no difference. The short run, if you're trying to get pregnant right away, it may be delayed.
Okay, last question, because it seems to be important to everybody. How soon after reversal can you have sex?
Different. So vasectomies, I say whenever you're comfortable, but with reversals, it's microsurgery. So the story is you put these fine sutures in, your body starts healing by throwing collagen on it.
Okay.
It starts around 5 days, and in about 3 weeks, the collagen that you lay on will make the area stronger than naturally. So I usually say 3 weeks to sex, just based on biology. But I like you to run it soon so you keep things open. And if it's a straight connection, 4 weeks if you have a more complicated bypass. And that's pretty set in stone. And guys are like, they feel good after a couple days. They're back to work. I don't want you exercising for 2 weeks or 3 weeks because, again, jostling is not good. I had a man had a vasectomy reversal, had a kid, comes in, trying to have a second kid, no sperm, and it was unusual because it's called a closure, it's late. And then his wife pipes in and says he's been on the trampoline with his child for an hour or two a day, his first child. And I'm wondering, could that have something to do with it? And I was like, because he was constantly jostling. Anyway, I said, just stop that. His sperm count came back. So it was the tensile strength. You know, it was really interesting.
If I've learned one thing doing this podcast with you, it is that medicine is not absolute.
Observations are everything. Yeah.
Observations are everything, that every person is different, that everything has a reason, but you have to go through the
biology,
steps of, right? Of, okay, well, is it this? No, is it this?
Yep.
And it's so great to just go, hey, why don't you just stop jumping on the trampoline? And it worked. Right?
Yeah.
That's it. And it's just really common sense.
I think a lot of people don't go to that level, but if you have to ask, why did that happen? I know my rates. They're very low. I know the biology. I know the science. And that's just a probability play. Mm-hmm. So I'll say, okay, the chance of this is 1%. There's got to be something else. What's the 99? And so you have to look for the 99. And if you don't look for it, you'll never find it. If you took that observation of he's trampolining 2 hours, and you know that's the motion, right?
Yeah.
That puts tensile strength on it. Tensile stress. That's all. It's all probabilities. You just have to work with them.
What do you want to say to the audience out there before we close about vasectomies and reversals?
Vasectomies are the best contraceptive. The lack of compliance needed. There's no compliance. It's liberating. It's irreversible until you ask me to reverse it. And I think men truly enjoy it. Reversals are quite doable. My rates of success, meaning getting sperm back, run in the high 90s for 15 years and then run into the 80s and published. I mean, it's so reversible.
So what that does, when you have those stats and the history and experience that you have and the success you have with reversals, it lessens that PTSD and that panic and that big decision that we started talking about what guys like me go through when we're going to decide to get a vasectomy. It's a big effing decision to make. And you're saying this is great. It's permanent. But just in case I have these stats and we can reverse it.
In the interview of the vasectomy, I show the graph of the chance you're going to get sperm back by the age of your vasectomy from 0 to 40 years.
Yeah.
40-year-old vasectomies. Not age, man, 40-year-old vasectomies have an 85% chance of getting sperm back.
So that's great.
So you can see them sighing, like,
yeah,
because it's data. It's like they need data. They don't need someone to,
yeah. It sounds like this is analytics and data. It's like
men respond really well to data.
Moneyball.
This is the Moneyball of vasectomy reversal.
There you go. It's the Moneyballs. Well, look. As the everyman on this show, I am encouraging guys that vasectomies are not too scary. They are a great freedom to not ever have to worry about getting your wife or anyone else pregnant. I recommend Paul Turek. He did a great job. The brosectomy was a way to go. So call your friends and see if somebody is looking to do it, because, again, even if you're not going to go through the fanfare of the hotels and massages and everything, I'm saying that it's just a good idea to go with somebody, a buddy.
Yep.
Do it together. Then you're not all out there questioning things. You just have somebody to talk to about it and not make it a big deal. All right. Well, this has been another great show. We want everybody to like, follow, and subscribe on YouTube, on Facebook, Instagram. You're doing TikTok now. It's @TalkWithTurek. And we'll be back next month with another great episode. Thanks again for
Rob Clyde.
all the information. You're welcome, Paul.
Bye now.
Thanks for joining the Talk with Turek podcast. Today's show was executive produced by Rob Clyde and Jennifer Harris. DP engineered and edited by Drew Unser. Thanks to Avery Clyde, Shen Heckel, Max Flora, and Jonathan Raju. Talk with Turek is produced and recorded in Los Angeles, California, in association with Hey Babe Media. Subscribe to our show wherever you listen to podcasts and watch us on YouTube. For more information or to book an appointment, whether in person or virtual, visit Dr. Turek online at theturekclinic.com or call 1-888-TUREK-MD, TUREKMD. Don't miss our next episode as we delve deeper into men's fertility and sexual health on Talk with Turek. And be sure to follow us on Instagram and Facebook @TalkWithTurek for updates and more content.